What is up, professionally integrated? We're going to keep this quick, short, and I just want to give you a couple of tips of what we do, my wife and I do in our office using professionally integrated to educate those new patients that are coming in that might have a disc pathology. Now, we're not going to dive deep into um, going over the disc anatomy and disc pathology and the difference between disc bulge and herniation. All that stuff's on the site. What we want to do is increase our communication with patients that are coming in with a disc problem, right? What do you say? What do you do? So let's get started. And I'm going to make this kind of quick and fun. And if you have any questions, fire off. I know a lot of you can't be on here live, and that's why we have hundreds of these videos that are already up for you to watch 365, 24/7. I know you're busy docs and have families just like me, so be sure to watch this. And here's a challenge for you all. Watch at least one video to two videos a week. Listen to it, hear it, inform yourself on the research and the education. The more you know it, the easier you can communicate it, and you can start talking to your patients better. So let's go ahead and, let's get this going here. And I just want to show you a couple examples of how we use this in our office with disc issues. I don't know why this keeps reading the subtitles, but hey, I'm going to leave it on here. I don't know if that's working or not. So, new patient comes in and they have a disc issue. What do you do? What do you say? Well, this is already after you did the initial exam. Now, if you're new to professionally integrated or haven't used it, remember, right on here, you could just type in initial exam and boom, tons of webinars come up where we show you how to document initial exams, how to do initial exams for disc pathologies, for instability, upper cervical instability, facet, ligament, loss of curve, all that stuff. So you have this type of information. We're not going to get into that right now. We're going to get into some disc health. So first thing we do, patient comes in um, with disc. We want to know, what does the disc need to be healthy, right? What does a disc need to be healthy? And we're going to talk about that. What it really needs is what? Let's go over them. And we ask patients this. What a disc needs to be healthy is normal mechanics and pressure on it and normal movement. And we're going to get into that. So what are some disc issues? Well, of course, as we talked about, there's herniations with and without radicular symptoms. Sometimes the radicular can be from a direct nerve compression, or it could be what? Chemical radiculopathy. You could also have disc degeneration, osteoarthritis. A lot of what chiropractors are going to see, they hurt, they have axial spine pain. So how do you relay your message, right? You get patients that they're going to be like, oh, I was told by my primary care physician or my blah, 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 that this is normal for my age. How do you combat that? They're like, this is normal for me. So let's get into a little bit of what we're going to do here, how we can further educate our patients on the condition that they're in your office for, or at least one of the conditions that they're in your office for. So patient comes in, they have an MRI, and you're seeing what? You're seeing dark discs and you see light discs. That is a sign of a problem. Let's take a look at what it says here. Disc desiccation or dehydration of disc desiccation is a hallmark of early intervertebral disc degeneration. It is characterized by the loss of water content in the nucleus pulposus, resulting in reduced disc height and elasticity. On MRI, this condition manifests as a reduction in T2 weighted signal intensity, commonly referred to as dark discs, and is one of the earliest imaging findings of disc degeneration. So patient comes in and they have dark discs. What do we say to them? What do you say to them? Hey, take a look. This is what we do. See how it's whiter up here? The white on this MRI shows that there's hydration. Your discs need a lot of fluid. The way they get that fluid, Mary, is with normal mechanics and normal motion. You're not getting one or both of these. And we're going to, we have other webinars on here about looking at the x-rays and normal mechanics. So what we want to do here is we can see these discs are dehydrated. Dehydrated discs can hurt. You have axial back pain, and during our examination, we saw that this was clearly correlated to this. Now, how do we get these darker discs to look white again? We need to start to feed them. We need to start to feed them, and we need to help them go to the bathroom. How does that happen physiologically in your body, Mary? Remember we talked about normal structure and motion? We're going to get normal movement in there, and our adjustments are going to break up these adhesions. We're going to get normal movement and normal mechanics, and we're going to try to start to get normal nutrition into the discs. Boom. Let's get into degeneration. Maybe it's a neck x-ray. They have a loss of the cervical curve. See how these discs are real fat and spaced down here? See in your middle neck where when I palpate you, there's pain. When we did your exam, these correlate. You're getting further degeneration. Now, Mary, remember you mentioned that that's normal or it's because of your age. Look at these discs that are pretty fat and healthy. Are they the same age as the discs? Did you get them at the same time? And they're like, oh, yeah. Well, then explain to me if it's just normal with age, how come some are degenerating faster? And the reason that is, as we discussed, there's abnormal structure. And one of the reasons we took this x-ray is to evaluate that. We also explain to our patients, we're not afraid of educating our patients. We're not afraid of it going over their head because we're here to inform them. We're here to give them the information that they're here for. They're not here to be sold, oh, you have back pain. Let me connect with you emotionally. Pain is already emotional. How are you going to fix them? Explain to me why this is a problem so that I know how to get this better when I'm not just in your office. So we explain how a disc stays and gets healthy. We want normal motion, we want normal structure. And then you might get technical. We always ask, it's a while to us when we say, hey, do you like research and science? Most patients are like, yeah, I love it. Because if you don't do it, what are they going to do? They're going to go home, Google, Chat GPT, and they're going to be like, can chiropractic help? And all this weird stuff might show up. So we show them the stuff on professionally integrated. It's easy for you to use. Coming from Journal of Neurosurgery, Journal of Biomechanics, all sorts of different articles that they're not going to get on Google. And it's going to be more superior to the information they get in blogs. So we ask them, right? Again, this is right off of professionally integrated. There's a study that talks about disc damage leads to more disc damage and degeneration, but it's not due to the age. And we show them that. We explain it to them. Hey, look, Mary, here's this study. We keep ourselves informed. And the reason we keep ourselves informed is so that we can help you better. We understand that when your disc is degenerating, it can lead to more degeneration. Take a look at what this study says, and we show them, right? We explain to them that, like, oh, you were told it's normal. Well, look, here's a study here that actually shows that when they did a huge meta-analysis of people at 50 years old, they found that a disc bulge and degeneration and other findings, just like you have, is more associated with back pain compared to asymptomatic individuals. So that's not totally true. Your findings are correlated to your back pain, and we're going to try to get better health in those discs to minimize your pain. And that study I showed you before, minimize other discs to follow suit and degenerate. We don't want this to become a more level problem. Again, maybe it's in your neck. Again, right off of professionally integrated. Here's a study, quickly copy, paste, put in your notes. We have down below on most of these, we have easy printouts for you to print out or copy and paste and email to your patient. Let me show you what this means. Hey, on your x-ray, you had a kyphosis. Look what it shows. It's one of the most common problems associated with pain. And that as a result, it can lead to more degeneration, leading to irritation of your spine. Here's another study we pulled up on professionally integrated. And I show them this. Hey, here's a study that actually shows that your kyphosis, remember on your x-ray, this actually shows that it mechanically influences the disc. So I know you've been diagnosed with disc pathology, but why is your disc breaking down? Well, here's a study, and I believe this was from Journal of Pain Resolution. Look what it shows. Cervical kyphosis mechanically influences the intervertebral disc, which may lead to neck, shoulder, and scap pain. So what this study is showing and why we look at this and talk about this in our office, we understand the abnormal mechanical load and the true subluxations of your spine have been studied, and that abnormal mechanical load is causing your disc to break down. So we are going to fix your disc, or help your disc by what? By improving that normal structure and getting appropriate movement. Does that make sense, Mary? If you'd like, would you want me to print you out this paper really quick, or some parts of this paper? There's also printouts at the front desk. Let me give that to you. Give it to your spouse so they can understand what you're doing, and maybe they have degeneration too, and they'd be more than happy to give us a call. You have degeneration in your neck. You have abnormal sagittal alignment, which is causing disc herniation. Let me show you this study where they looked at the lumbar spine, just like how you're coming in here today, and they actually showed that the reason you have a disc herniation is due to your abnormal back curvature. So remember we went over your x-rays? So what they're showing is that this study proves or shows that abnormal sagittal alignment is causing your disc to herniate. So you can get all the injections in the world and take all the drugs in the world, but it's not going to fix the true subluxation, the true structural problems. That's what we're going to do here in our office. right? So then what do? Right? How are you going to help them? Right? This is what we say. We go over the information, we show them the research on professionally integrated, we talk to them, we're like, so we just discussed that your disc problems are due to what, Mary? My abnormal shape and abnormal movement, right? So if you have abnormal shape and abnormal movement, what does the disc need to get healthy? Well, it needs appropriate weight distribution and movement, correct? So how are you going to get that? Doing regular exercises around an improperly functioning spine. What we're going to do is we're going to start to improve the normal shape. We're going to adjust the areas that aren't moving to improve normal mechanics and movement. Break adhesions and getting movement is going to do what? It's going to start to feed that disc, right? And when we feed that disc, we're also going to get some of the waste out so that we can get better vascular supply and better nutrient channels in and get the waste out so that disc can start to heal. So, quick recap. Again, we're going to keep this super quick. I'm sure the people that are watching right now, you're like, maybe I should make an appointment, and you should. We're going to discuss their questions. Are you old? Is that normal? We're going to break that down. We're going to educate them using the site on their actual pathology. We're going to inform and empower them. We're not going to sell them. They're already in our office. They're here to get their questions answered. They want to know, are they in the right place? By having professionally integrated, showing them the research, it shows that you are ready for their questions and you took additional time to be ready for their appointment. You understand what's going on and you can understand why they have a problem and you're actually giving them answers. You're going to discuss the above on how you can help them, right? How does the adjustment help? So that's pretty much what I want you to do. Now we're going to show you some other stuff here, right? Again, go right to disc. Again, you can go right to disc, and then you're going to have causation, chronic. Oh, you have chronic pain. Here's a bunch that leads to chronic pain. And we show them stuff like this all the time. Hey, here's stuff. Here's how the disc gets injured, whatever it may be. Search for disc, pain, all sorts of other stuff, right? And then look to see what else is happening with their spine. What else is going on, right? Fibromyalgia down below. If you scroll on the bottom, um, you can do a quick patient handout. A lot of times we'll copy and paste this and send it right to their email and be like, hey, you had these questions. Let me show you what's going on. So again, that's what we're going to do. You want to educate, inform, empower these patients using the tools that you have available to show the patient that you're up to date on what's wrong. You took the time to get ready for their appointment, and you can show them, oh no, Mary, I'm really familiar with this. And let me show you, like, here's another one, as I was showing you earlier. Here's a copy and paste, but some of this, hey, Mary, look, this is a paper that was out of down at the bottom. It shows where it's from. This is from December 2022 from Journal of Pain Resolution. Here you go. And then look what they say. Or sorry, this is from Musculoskeletal Science and Practice. Incidence of cervical kyphosis and posterior translation and neck pain associated with radiological evidence of disc disease. So musculoskeletal science says that your abnormal curve causes a disc to break down. Here's the highlights, and then look, we print this out. That's at the front. Hey, let me show you. 60% of patients with neck pain have disc degeneration, but take a look at what's happening. Super quick, super simple, easy, but you have to use the site. So again, get on it. Another challenge, listen to 1 or 2 videos on research or webinars a week, inform yourself, and then talk to the patients about it and see how many new referrals you get and more informed, empowered patients. Thanks so much, professionallyintegrated.com. Thanks so much, everyone.